Most welcome in this video. Excellent choice. Let's dive into the gross anatomy of the kidney, covered AZ at graduate level depth, as expected in anatomy, dissection exams, and postgraduate physiology or surgery courses. This section provides clear, structured, and complete notes, including position, coverings, surfaces, internal structures, vascular supply, and relations, all with clinical insight. Gross anatomy of the kidney, graduate level. 1. Overview. Kidneys are paired retroperitoneal organs that filter blood, regulate electrolyte and fluid balance, and produce hormones: erythropoietin, renin, calcitriol. Shape: bean shaped, with a convex lateral and concave medial border. Weight: to 150 grams, male, to 135 grams, female. Color: reddish-brown in the fresh state. Dimensions: tilde 11 centimeters long, 6 centimeters wide, 3 centimeters thick. 2. Position: kidney vertebral level, lower pole relation. Right kidney T12, L, 3 to 1 centimeter lower, due to liver. Left kidney T11L2, slightly higher, is greater than hilum of kidney, lies opposite the transpyloric plane. L1 on the right and slightly higher on the left. 3. External features: hilum, medial concavity where structures enter, divided by exit. Anterior, posterior. Renal vein, renal artery, renal pelvis. VAP order. Sinus of kidney: internal cavity within hilum containing renal pelvis, calyces, vessels, nerves, fat. Poles: upper pole, capped by adrenal gland. Lower pole, nearer to iliac crest. Borders: lateral, convex, medial, concave, containing the hilum. 4. Coverings of the kidney, from inside outwards. 1. Fibrous capsule, renal capsule, tough, adherent, easily stripped in healthy kidney. 2. Perirenal, adipose, fat, cushions kidney within renal fascia. 3. Renal fascia, Gerota's fascia, fibrous sheath enclosing kidney and adrenal gland. 4. Pararenal fat, outermost layer between fascia and posterior abdominal wall, is greater than. These layers anchor and protect the kidney. Loss of fat may cause ptosis, renal descent. 5. Relations: right kidney anterior, liver, duodenum, second part. Right colic flexure, small intestine. Posterior, diaphragm, dodicith rib, psoas major, quadratus lumborum, transversus abdominis. Nerves: subcostal, iliohypogastric, ilioinguinal. Left kidney, anterior, stomach, spleen, pancreas, left colic flexure, jejunum. Posterior, diaphragm, 11th and 12th ribs, same muscles and nerves as right, is greater than. The left kidney is higher and related to 11th and 12th ribs, while the right relates only to the 12th rib. 6. Internal structure cut. Longitudinally reveals renal cortex and renal medulla. Cortex outer, granular zone beneath capsule, contains renal corpuscles and convoluted tubules. Extends inward between pyramids as renal columns of Burton. Medulla composed of 18 renal pyramids, with base toward cortex, apex, renal papilla, projecting into minor calyx. Medullary rays, striations from medulla into cortex. Renal sinus, space within kidney containing calyces, pelvis, fat, vessels. Collecting system. 1. Minor calyces receive urine from papillae. 2. Major calyces, formed by union of 2-3 minor calyces. 3. Renal pelvis. Funnel. Shaped structure continuous with ureter. 7. Blood supply arterial renal. Artery branch of abdominal aorta. At L1, L2. Divides into 1. Segmental arteries. End arteries. 2. Interlobar arteries between pyramids. Arcuate arteries along corticomedullary junction. 4. Interlobular arteries. Afferent arterioles. Glomerular capillaries. Efferent arterioles. Peritubular capillaries. Or vasa recta. Venous. Renal vein drains into IVC. Left longer. Crosses aorta under SMA. Left renal vein receives. Left gonadal vein. Left suprarenal vein is greater than clinical. Left renal vein may be compressed between SMA and aorta nutcracker syndrome. 8. Nerve supply renal plexus. Autonomic. From celiac and aortocarinal ganglia. Sympathetic. T. 10. L. 1 vasoconstriction. Renin release. Parasympathetic. From vagus. Minimal effect. Pain. Referred to flank groin. T12. L. 2 dermatomes. 9. Lymphatic drainage. To lateral aortic, para-aortic, lymph nodes around renal vessels. 10. Segmental anatomy. 5. Surgical segments and arterial zones. 1. Apical. 2. Upper. 3. Middle. Anterior. 4. Lower. Anterior. 5. Posterior is greater than each supplied by a segmental artery, no anastomosis. Critical in partial nephrectomy planning. 11. Ureteric relations. At hilum. From anterior posterior. Renal vein, renal artery. Renal pelvis, mnemonic. VAP, vein artery, pelvis. 12. Clinical correlations. Renal ptosis, due to loss of pararenal fat. Renal colic, pain from ureteric stone, referred along T11, L, 2 dermatomes. Horseshoe kidney, fusion of lower poles, caught under IMA. Polycystic kidney, cystic dilation of nephrons. Segmental artery occlusion, localized infarction, end arteries. 13. Surface projection vertical axis. Tilde parallel to psoas major. Oblique downward and lateral. Hilum. Opposite L. 1. Transpyloric plane. On right. Slightly higher on left. 14. Important radiological points. Seen on plain X-ray as soft tissue shadows at T12. L3. Intravenous urography, IVU. Outlines, calyces, and pelvis. CT divided by CT angiography. Defines segmental vessels and relations.